We're back on Facebook Live and Twitter on our post show, continuing our conversation about COVID-19, mental health, and communities of color. So I've heard from all of you about some, basic coping techniques in the house and the self-isolation. But I want to go back to the whole community piece that you raised earlier and how much it's connected to our cultural needs, that you just really can't name any community of color where community, that coming together in some form or another, is really central to their pretty much everyday lives. And as part of that, we often have older people living with us. So there's going to be a multi-generational situation as we're inside together. And I wanted you to speak to, how do you deal with that if maybe one person in the house is having some issues and others are not? I mean, how do you balance all that? And so people can take care of themselves as they try to care for others. Xenia, I'll start with you.
Sure. So I think the first thing is to recognize that we are social people, but in context of being social, we also need our isolation. We need our moments of separation. But for those in our families that we are closest to who may be older or more vulnerable, I think it's important for us to assure them that we have their best interest at heart. We're not going to put them at increased risk. And that we are going to be able to manage our stressors and help to manage the stressors of our closest family, if by chance they live with us. I would also say, though, that taking care of our older family members also includes taking care of our younger family members and reassuring them that very few of us are going to get the illness. There are ways we can control it. We can control getting the illness, avoiding contact with others, washing our hands, sneezing into our sleeves or our elbows. So I think that there are ways in which, even with our elderly or our older family members, we can reassure them that we are keeping them safe, just as we do when we're with our littler family members as well. Okay.
Cecil, I heard you trying to say something.
Oh, yeah. I was just going to say, once long ago from a mentor of mine, I got this really great piece of advice of never worrying alone, like never worry alone. And I think it's a really good piece of advice, especially in situations like these, where things can really feel out of our control, that we feel overwhelmed. And if we notice somebody in our household or even, outside of our household, maybe they've dropped off of social media if they're outside of our household, or maybe they're spending more time in the room than you would expect. It's okay to talk with that person. It's like, hey, I noticed that, we were all cooking in the kitchen and you didn't come in and you love making lasagna or whatever it might be. Being able to make those observations with somebody, they might take the opportunity to open up a little bit more and be like, yeah, I'm actually kind of stressed out about all of this. And I'm not really sure what to do about all of this. Or maybe it's something like, oh, I just found out that I'm going to be furloughed or I lost my job or what have you. It just creates an opportunity for connection. And we're inherently connected beings.
Charmain?
Yeah. I think one of the biggest things is, patience and compassion. I think the challenge of being home and quarantined, just the nerves are, really people can be really impatient with each other. And I really be patient and find time to take space for self-compassion. There's a lot of things that we can't control, but we can control how we respond to situations. Talk to parents. If you need to take a break, go take a shower. Cry in the shower. Scream in the shower. Finding spaces where you can find time to for downtime. I think one of the things we talked about and wanted to raise again was this idea, because of the stigma around COVID and the way that it presents, that people they're positive, they have to be isolated. And so I have a friend who worked on the front line and she talked about those who were dying or ICU. Mm-hmm. And so that level of grief that we're all experiencing is even more profound as you watch or you have a family member dying and you can't
Charmain, I thank you for that, but your mic is going in and out, so I can't quite catch it, but I think we got the essence of that kind of really painful situation. So I thank you for sharing that. We have a Facebook question. So all of you have stressed that the importance of staying connected, even if physically distant. So they say, so you have to go out, and when you go out, you have to be separated, and you don't look at people. Doesn't that add to the disconnect? I mean, that's what you have to do to stay safe, potentially, from this virus, because we don't know, who has it or who doesn't. But that seems, so says the questioner, to add to anxiety. Cecil, I'll start with you.
Yeah, absolutely. There are some psychoanalytic ideas that are actually really helpful with this, that really mirror a lot of our biological science, where our connected with other individuals is very important. Like, that's a part of our inherent quality as human beings. But we have a tendency to create in-groups and out-groups, like those that are like us, like the we, and then also the other. So what happens with the stigma of COVID and coronavirus is that all of a sudden everybody becomes other. We really tap into more of those like primitive parts of our brains that don't allow us to sort of think in that sort of higher function way of like, oh, this is my neighbor and she's like freaked out about this just like I am. And it really disallows some of us to have that compassion that we have for one another. Instead, we might like clutch our purses or like our grocery bags and like skedaddle very quickly down the street, not saying hello in the usual ways or not offering like help or advice or whatever it might be that we ordinarily would.
Did you want to weigh in on that, Xenia?
No. I had another thought about something, but I'll hold that for later.
This is the question I have, which is that a number of people of color, just by virtue of this is the society that we live in, end up performing these essential tasks. So many of us are sheltering at home only to go out to do essential business. But then the drivers, the cleaners, and we've talked about frontline healthcare workers, the food service people for sure, are all involved in essential services. And I wonder about the burden of not only you have the fear of I'm working and I don't know what's going on with this virus and how it is spread, but also sort of the weight of carrying the essentiality of it, if you know what I mean. That seems to me to be quite a powerful burden, I guess I would say, Xenia.
It is. And that actually does lead into what I thought that I wanted to share. I had heard from a colleague in Brooklyn recently that a large number of the Black population are not getting tested.
Yeah.
And generally, those are the essential workers, the people who are driving the taxis, who are doing the cleaning, who are at the grocery stores, who are likely to lose potential time, can't lose time off work because they don't have paid time leave. And yet they are, when they're coming into the emergency room, they are not being and presenting with symptoms that look like flu-like. They're not being defined as coronavirus eligible or qualified, so they don't get tested. And generally, those are the African American or communities of color where that's happening. And so they are carrying a large burden of this, the illness in the population. And I think it's up to us, those in the healthcare field, but those outside the healthcare field, to begin to champion a cause that says that everyone should be tested, not just those with $1 million pockets and those who could potentially get results in 45 minutes, and the rest of us wait 4 or 5 days. But we should be campaigning that everyone has equal access to health care, no matter what the cost is, no matter what their paycheck is, and no matter what station in life they are, because we're all essential.
Well, according to the president's task force, the cost of the test is absorbed by the government at this point. However, to your point, frontline healthcare workers, the people in the room with the respirators, cannot get tested at this point. So there are a lot of people going home unclear about whether or not they have the virus, which is why many of them or have been been infected are not going home because they don't know, and they keep trying to get tested and can't. So we have a testing problem to begin with, and that may be helped somewhat by this new partnership that in Massachusetts anyway, that Governor Baker just engaged in with Partners in Health. These are the people that did a lot of work around the Ebola crisis, and they developed a program around contact tracing, which means you know a person that has been around somebody who has been infected, and you go back and trace very carefully who they interacted with. And by doing that, you get closer and closer to where the areas of infection are. And so that was just announced today. That gets started, and they're putting a lot of people on the task. So hopefully, as Governor Baker says, I can't solve everything everywhere, but in Massachusetts, maybe we can catch up to getting more information about exactly where virus is spreading in greater than in other places, and among whom, or not, as you say. Yeah,
I would suggest we all act as if we're infected.
Well, I think we are. Yes. But it's the data. I mean, I think what people are looking down the road, and you all can respond to this, is that keeping people inside against all of the routines, as much as you all have explained what people should do, is really hard. So there's going to come a point where a lot of people are going to break ranks. And then we're all in a mess if we don't have any information about, at least don't go over here, don't do this. Something, we need to know something. We can't just break ranks and know nothing as we do at this point, I guess is what I'm saying.
That's very true.
Something else has to move along. Right. So that's one point, and I take your point about the testing. But it occurred to me that the population of people performing essential tasks, and oh, by the way, I didn't mention agriculture, all the people where the crops are dying because the people that usually take care of the crops are Latino. They can't, come out and pick the crops. So we're about to have a supply chain issue as well because of that. So we're kind of in a mess. We're kind of in a mess right now. And go ahead, Cecil.
Well, related to that, I think the fundamental issue is how we determine what's for the common good that we all benefit from, and balancing that out with our own personal need. It's really hard to stay at home. I will say personally, I really miss having that camaraderie with people and bumping into people on the sidewalk and giving high five to my 9-year-old patients, etc. But we have to balance that with the data that we don't have as much of. If people really knew and understand how their breaking protocol might in fact lead to significant numbers of deaths and certainly illnesses in ways that we don't quite comprehend, it might give people more pause. In addition, I think there needs to be a really strong message about how we are doing this for all of us, for ourselves, for our communities, for our country, for the world, really. But again, that has very much to do with the in-group, out-group sort of mentality that we have as human beings. And that can really start to trip up if we're really focused on blaming different people or different individuals rather than focusing on how we're doing all this for all of us together.
So you're referring to the Asian American bias that's still pretty strong that's out there now. Yeah.
Absolutely. And not just on a small scale individual, but in a larger policy way. If we don't have data to show how many people get infected, where they move, we can't contain anything that we don't have data on. And when we start to make the focus be where this came from, this is I think people have referred to it as a Chinese virus. Viruses don't have passports, and there's no possible way for us to actually tackle what the real issues are and to have the sort of solidarity that we need in order to tackle this. If 5 or 10% of people break off and break quarantine, that puts us all at much more grave risk than if we were all to stay inside.
So I started off asking a question earlier in the conversation about stigma and how powerful it is in our communities of color. But I wonder, because people can really feel some of the isolation that you talked about, they can feel some of the anxiety, they know what it is, even if they can't articulate it, to calm down grandma so-and-so while dealing with the grandchild over here or the teenager. So will there maybe come out of this a greater appreciation in our communities of color for what mental health therapists can offer, or just being able to understand that your mental health is very important?
I'd like to jump in on that. I know Dr. Jackman.
Definitely, I hope so. And we've seen, I've seen in the last 3 years, there's been a change in how people are open to get in therapy, seeing therapists. So a lot of the messaging that I'm doing with my organization, InnoSight, is around promoting mental health, focused message on mental health, emotional wellness, kind of a general well-being, not just mental health, it's general well-being. On.
Well, that's
and I think
thing.
people
that's a good thing.
Are responding to that message.
Xenia?
Yeah, no. This is one of my mantras. I believe that mental health has gotten a bad name. Mental health is all about pathology, meaning the illness. But really, mental health is about the wellness. It is about being able to live your life in a way that obstacles don't distract you or deter you. And those take mental skills. That means muscling up your mental ability every day in every way. Behaviors are guided by beliefs, and beliefs are thoughts. And if you can assess and evaluate your thoughts to make sure that they're healthy and strong, your mental health, even if you encounter something like depression or anxiety, is much better off.
Well, I want to thank all of you for joining me tonight and offering your insight in this very important topic. I think the words of the day are stay safe, but I would say for your group, what you've shown us is we must always also stay well. So thank you for joining us.
Thank you.